Hi folks, it's Dr. Mike and we're back here for another 30 for 30. It's October 25th, which means it's our 25th installment of 30 for 30. And remember, 30 for 30 is over the course of 30 days, we're giving you 30 tips you can use to help build your medical exercise training practice or actions you can take to build your medical exercise training practice. Now, over the last couple of days, we've talked about the idea of a medical exercise training client management system. We've talked about the initial contact and the initial session. We've talked about the assessment. Yesterday, we talked about the post-assessment procedures. We also talked a little bit about scheduling the client. So today, we're going to talk about the training session itself. Now, all of you out there, you've worked with clients on numerous occasions. You've done this, you're experienced at it. You've worked with a personal training client or the apparently healthy client. With the medical exercise training client, we've got a number of T's to cross and I's to dot when we start looking at this client. The biggest one is checking blood pressure and heart rate, especially in those clients that are hypertensive. I would say for any client coming in the door, if they're not hypertensive or diabetic, for the first 2 sessions, please do check blood pressure and heart rate. Then with this, if the client is diabetic, make sure the client uses their glucometer to measure their blood glucose level. Vitally important because we don't want the client to bottom out and become hypoglycemic during the exercise session and now have a problem. So make sure the client checks that. You don't, the client does, but you want to make sure that you're there to record that information. With blood pressure and heart rate, make sure you record these, and you can use electronic blood pressure cuff or heart rate monitor to check these. And especially with your hypertensive clients, this should be something that's done on an ongoing basis. For those clients that are not hypertensive or diabetic, I would say make sure you check these in the first couple of sessions, but after that, not a big deal. They can check it themselves. But blood glucose, if they're diabetic, that's something we want to do on an ongoing basis. Warm up the client after you've done all the vital signs check. Here at Medical Fitness Pros, we have bicycles, we have recumbent bikes, we have ellipticals, we also have an upper body ergometer. Those all work well, particularly the upper body ergometer we found works great for clients that have upper extremity disorders. But prior to the session, you want to have some type of session goals. What is it that you're trying to accomplish in this session? And these goals for the session should relate back to the functional deficits that you identified with the assessment. And the functional deficits are based on the client's critical job demands, whether they're job demands from the standpoint of what they do in their workplace or lifestyle demands, what they have to do in their lifestyle, or maybe sporting demands, what they do with the particular sport they participate in. But those functional deficits eventually are also connected to the short-term and long-term goals, and your session goals should relate back to those short-term and long-term goals, which again relate back to the functional deficits. So when you actually start training the client, your exercise programs or the exercise activities the client is going to participate in should relate back to those short-term and long-term goals, again, going back to the functional deficits. Because the idea here is the client was referred to you because they had functional deficits that were left over after physical therapy, chiropractic, and medical care were done. And we know those are out there because insurance carriers are paying less. Clients aren't getting as much physical therapy and chiropractic services as they did before. So now we realize medical exercise training really does become an important component of the overall medical management process. So you train the client. Now, let me mention one thing here. Before or during and also after, you want to do reassessments. And the reassessment doesn't have to be something full-blown and extensive. The reassessment could just simply be asking the client how they're doing or what they did between the last time you saw them and the current session, or how they're tolerating exercise during the current session. That gives you an idea of the client's tissue tolerance level. It also gives you an idea how they're progressing. And if you understand the anatomy and pathology, which we talked about back here with the initial contact, if you understand the anatomy and pathology, that kind of gives you an idea of how the client is progressing along the way. One important thing here that I think is going to make the difference with medical exercise training compared to personal training is documentation. And folks, I know nobody out there likes to document. In all the years I've practiced as a physical therapist, documenting is the biggest pain in the butt there is. But now you got the medically based client. You've got to protect yourself and protect the client. That's why documentation becomes important. You've got to document what the client says when they come into the session or anything they say along the way. You've also got to document the activities and the exercises that the client performed during the session. You also have to document how well the client tolerated the exercise, but you also have to document what you're going to do with the client in the next session. So this documentation now is showing that you're moving the client forward to those goals that we established, and those goals are based on the functional outcome measures that are based on the functional deficits. So you can see it all kind of is a circle that's all connected. But the key here now is you've got to document all of this stuff. Now, one last point here. We talk about now evidence-based training or exercise. But folks, when I started as a physical therapist, I decided I wanted to be an orthopedic manual therapist. So I attended extensive graduate training and then more extensively advanced clinical workshops. And along the way, with everything that I was taught, there was a rationale, there was a research-based rationale for doing it. So everything that you do with your clients should be based on some type of guideline or research that's out there, which means as medical exercise professionals, we've got to spend more time reviewing the research, not just simply the current research, but the past research, because current research is based on what was done years ago. And I find now we're looking at current research, but we've got to look at past research to make sure that we're able to integrate all of these new concepts and exercise concepts into the exercise program, and we have a rationale as to why. That becomes vitally important. So with the training session, again, check vitals if necessary, particularly blood glucose for your diabetic clients. Warm them up, have session goals, train them, and then document everything. Now, medical exercise training is going to get bigger and bigger over the next 20 years because of who? Me, the baby boomers. This is going to become bigger, and the need to document is going to become even greater. If you need documentation forms, go over to postrehab.com. If you go to the resources on tab there, we have a full package of MET assessment and documentation forms that you can purchase. Folks, the reason I say that is because this is going to become bigger and bigger. It's going to become more important that you know what the client says, what you did with the client, because you're going to get some clients who are going to say you caused them further injury. You're going to have some clients that are going to need this documentation to support their cases if they've been involved in any type of injury process. And if there's any type of reimbursement possible, you're going to definitely need to have this documentation for any type of insurance reimbursement. And we are seeing, if you clearly identify who you are, your role, and you've identified that to the client, to the referral source, and to the insurance carrier, reimbursement for medical exercise training services is available. Now, we did a webinar recently where we looked at the 5 keys to insurance reimbursement for medical exercise training services. If you go over to MedX Pro 360, you'll actually see that webinar. I urge you to take a look at it, and it will really tell you why this documentation process is important, but it also, this documentation process kind of ties into the whole MET client management process. So thanks for listening in. Hopefully you're having a good day and you'll continue to have one. We'll be back tomorrow, and tomorrow we'll talk about the progress report. So please go over to MedX Pro 360, check out our community for medical exercise professionals. And if you want to ask me questions, email me at drmike@postrehab.com. Thanks for listening in. Have a great remainder of the day. We'll see you tomorrow. All the best, folks. Bye-bye.